When you feel hip pain, it can be hard to know whether or not you should see a doctor. In this video, I'll try to help you understand what signs to look for that could indicate whether or not your hip injury is serious. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Hip pain can be caused by a variety of injuries and a variety of conditions, including arthritis, muscle strain, labral tear, tendonitis or bursitis, fractures, and stress fractures. Here are a few signs and symptoms to look out for that could indicate a more serious condition or serious injury. Inability to bear weight. That would be one that right away I would say, hey, maybe it's worth getting it checked out. Meaning maybe it hurts when you're running and then gets better. Maybe it starts to hurt when you're walking when it gets better. But that could be any number of different things. But if you're really struggling to bear weight due to pain, whether it's in your groin or the side of the hip, probably worth getting checked out to make sure it's not structural damage. Again, pain with weight bearing like running or walking that especially gets worse the more you do it, especially in females and younger females. And if that pain is in the groin, can be a sign of something like a stress fracture. Whereas if it's in the groin, maybe an older person that initially it's running, but then it's walking, things like that, maybe it's more problems like arthritis. Arthritis typically causes pain in the groin, and really anything in the ball and socket joint is typically groin pain or upper pain in the front of your thigh, upper thigh pain. That is typically where hip joint pain, hip arthritis, femoral neck stress fractures tend to be localized. Now, if you have pain maybe in the buttock that radiates down one leg, if you have numbness, tingling, or weakness in that one leg, that actually might not be coming from the hip joint, but instead might be caused from your lower back or coming from your lower back. The lumbar spine could be a herniated disc or something along those lines, a sciatica. That's kind of a completely different problem, but another sign that it's worth seeing a doctor, albeit just not maybe a hip problem, more of a lumbar spine problem. If you have any of those signs and symptoms, it can be a good idea to see an orthopedic surgeon or a hip or spine specialist, depending on the nature of those symptoms, so you can learn the exact nature and severity of the injury and start treatment to get back to normal. I'd love to hear about your hip injury, or maybe it's a lower back injury if it's buttock pain or pain shooting down one leg. Leave those in the comments below. I do read those. Just understand I can't offer medical advice online, so I rarely respond to those comments. But I do answer those questions as best I can in future videos. That's where all these Ask Dr. Geier video questions come from. Also, make sure to subscribe to my video channel. Click the bell to be notified when I release a new video and when I start my live streams, including my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.